I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest statistics through today, the 16th of November. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Hey, good morning.
So for some updated COVID statistics, 59% of the population in the United States is fully vaccinated, but we are now seeing a pretty massive incline in cases. The daily average last week was below 75,000 and it has now reached above 80,000. There's been an 11% increase over the last 14 days. We are also seeing an increase in more than 50% of states, but in a couple select states, they're seeing an over 40% increase, such as Minnesota, New Mexico, Vermont, Wisconsin, Nebraska, Indiana, Rhode Island, New York, Illinois, and Puerto Rico. In Illinois, as I just mentioned, there has been a massive jump in cases with a 53% increase, with your average of 3,220, with last week's being under 2,500. 91% of the population over 65 is fully vaccinated, but under 60% of the population in Illinois is vaccinated. What can you tell us about all of these states that are increasing so high in cases?
Well, I think what's happening is we're at the beginning of this fifth wave. If you look at the pattern of the United States, every country is not having 5 waves. Some have 2, some have 3. It all depends how they mitigate, how many people are vaccinated. And what they're doing about the wave. So it looks like we're going up now because so many states have these big increases, like Illinois, which had been doing relatively well, now is up over 50%. So you're going to see these waves come up, and really it depends what the states do to mitigate these increases. They have to do something, otherwise it's just going to shoot way up. And as you see in Colorado here, you've got the increase of 11%. So that's way down. So they're coming up to the peak of their wave, and most likely that will even out at some point and hopefully go down. I mean, it's just this pattern we keep seeing. In Israel, for example, where they have very uniform and strict mitigation efforts put into place, including booster shots and closing things, and everything is pretty centralized there, and the people they follow the rules. They have these very sharp, they have these spikes that go up and then they come down really quick. So the width of the wave is smaller than what we're seeing in the United States. Probably because the United States is such a big country, and you're having peaks in the south, and now we're having peaks in the northern Midwest, and that you're going to just keep seeing. But it's unfortunately going up, and it probably is a fifth wave, and we've got to do something about it coming into the holidays here, because we're going to have a lot of travel and mixing of people.
Yeah, definitely. And speaking of, being careful, the booster shots are now working according to some headlines. Rich countries want to turbocharge their rollout. What can you tell us a little bit about wealthy countries and the booster shots?
Yeah, the booster shots work. No matter what vaccine you had the first time, getting a booster shot, particularly with one of the mRNA vaccines, that's a Pfizer or Moderna, is really going to help you. It looks like the booster with the Moderna might be a little bit better in terms of monoclonal antibody, not monoclonal antibody, neutralizing antibody development. But that remains, it's incremental compared to the Pfizer one. So, but it's much better than the Johnson & Johnson or AstraZeneca, the viral vector ones. So that's really the only thing to keep in mind. But they do work. Your system is already primed, and recognizes that the antigen that's being presented because of the vaccine and responds like crazy. So that really helps. And so getting everybody boosted now is the important thing. The way this was rolled out did not work. It was a little bit too much over interpretation of data. From a public health standpoint, they knew right away that by 6 months, the antibody levels were dropping. And everyone should have just gotten the booster then, not just, you're high risk, you're over this age, you're in this employment group or whatever. That just caused a whole bunch of confusion. It should just be everybody. 4 states now, at least, are allowing the boosters to be given to anybody over 18. California, Colorado, New Mexico, and New York, and probably more. They're not even waiting for the federal government. The governors have to deal with this on a much more visceral level, and they're doing the right thing.
Definitely, definitely. And speaking of, being careful, give us a little bit of a holiday update now that we are about 10 days away from beginning the holidays. What can you tell us about being safe during the holiday season?
Yeah. We have to go on and live our lives, and we can protect ourselves from we can protect ourselves with the vaccine. We can protect ourselves from infection to some degree, but we really have a good chance of protecting ourselves from severe disease that results in hospitalization and or death. So, protect yourself and hang out with other or congregate with other vaccinated people. That's really the safest thing to do. It just depends how safe you want to be. If you don't care, just do whatever you want, but you're going to pay the price, and people are going to get sick. So have your family gatherings and gatherings of friends with vaccinated people. Outdoors, well, that's ridiculous in Illinois, in Chicago anyway, in Thanksgiving time and Christmas is like you're gonna be outdoors, bring a snowsuit. That's not gonna work. But if you can have more ventilation, maybe keep a window open if it's not too cold, keep the air circulating. It's really all about ventilation. Keep the groups small, if at all possible, and keep people spread out. Try not to congregate too much in one small place, particularly if it's not well ventilated in a dining room or something like that. If you could spread people out around the house, it's really just common sense type stuff, just to keep everybody, that will be as safe as possible. Another thing you can do, particularly if people are kind of outside of your immediate bubble, is have them get tested before they come. And this is any kind of test. They can get an over-the-counter test, and they're not 100%, but they're good, and they will pick up people who are actively infected. The problem is they don't pick them up very early in the infectious process. So say that people are coming for the weekend. Your kid is coming back from college and going to be there for 5 days or whatever. Have him or her get tested first, and then at least once or twice while they're there. That is as good as doing a PCR test. And just these simple tests, you can do them at home yourself, or they can do them in clinics and get the results in 15 minutes. So that's another option that you have.
Yeah, definitely. And now for some COVID questions. I received my full dose of Pfizer vaccine back in May. I'm ready for the booster. My doctor suggested I get the Moderna booster since I got the Pfizer previously. She said research is finding it's more effective. Any truth to this?
Well, yeah, there's a little bit of truth to this. In this NIH study where they looked at people who got one of the 3 vaccines and then boosted them with all 3, with one group got the same vaccine, one group got the Moderna, one group got the Pfizer, whatever. They did this nice little study, and they showed that you get benefit from boosting with everything, but the amount of neutralizing antibody was much higher if you had received the J&J vaccine and then got the Moderna or Pfizer. It was much higher than if they got just a booster with the J&J. So, and these antibody levels were even higher in the Moderna group. And that's where the little bit of truth that comes in here. Now, if your increase over baseline is 70-fold or 90-fold or 50-fold, does it really make much difference clinically? Probably not. That's just like huge increase. And so the difference is really kind of incremental. whether you go with the Moderna or Pfizer. If you got the J&J, I would say get the Moderna one. But if you had the Pfizer, you really have a choice. Whatever is kind of easiest to get. It really doesn't make any difference. But your booster should be one of the mRNA vaccines.
Yeah, that's good to hear. And for the second question, this individual is 66 years old and in pretty good health. They received the first Moderna vaccine on February 4th and the second one on March 4th of this year. Following May, they started to develop flu-like symptoms and were diagnosed with polymyalgia rheumatica. I know that PMR is stimulated from a virus and was wondering if the vaccine triggered its oncoming. What can you tell us about people with PMR and getting the vaccine?
Yeah, I mean, there is some association with that. It's very rare, but this person, okay, is a very rare person. First of all, the doctor or the patient should fill out a VAERS report, VAERS, a vaccine adverse event reporting form. Because it's important to collect data like this to see exactly how much out there really is. Now, as far as getting a booster shot, which is not really mentioned here, but I think that's the clinical question. This, you got to leave it up with the doctor that's taking care of the person. This is too complicated to just give a TV armchair, recommendation. It's not fair. Perhaps a different vaccine. They got Moderna. Maybe they should get one of the other ones. Like a Pfizer or something, that's all a possibility, but that's nothing really, I can't really make a formal clinical recommendation like that. The one good thing here is the Moderna does the antibody levels, at least, and the other parts of the immune system probably do hold up as well. They last a little bit longer than the Pfizer one. So, I think they're like okay for right now. But I think this really involves a report to the FDA, and which is a very simple form. I filled them out myself, and a hard discussion with the clinician that your doctor who's treating you, and it's always a risk-benefit ratio between what's the risk of getting COVID. COVID probably going to make it worse too. So that always has to play into the equation. But it's a very difficult question. With a complicated answer, and I think that has to be left between the patient and the doctor.
Definitely. Now for the third question. A week and a half after my second Moderna vaccine, I developed shingles and have read that this has happened to others after receiving a COVID vaccine. Since a person can have shingles more than once, am I in danger of developing shingles once again after receiving a Moderna booster?
Well, people have reported that, and a lot of people get shingles. So did the vaccine trigger it or not? Again, this could be reported in a VAERS report, the vaccine adverse event reporting thing to the FDA. But I think it's pretty well known that some people do get shingles outbreaks afterwards. One thing this person could do is get the shingles vaccine. They could wait a little bit, after everything is all calmed down, and go get the Shingrix, the really good shingles vaccine, before they get their next booster. And whether or not it's the Moderna or the Pfizer booster, I don't think it really makes too much of a difference.
Definitely. And for our last question, this morning on WGN, Dr. Murphy said in response to a question that you should absolutely not allow unvaccinated people to join your Thanksgiving celebration, but did not say why. Dr. Murphy, who is at risk? The unvaccinated person? Because if the vaccinated people have been vaccinated, why don't they have some protection? Otherwise, what's the point of getting vaccinated? So can you break this down a little bit for us?
Yeah, no, I'm glad this person asked, because it needs clarification. And I obviously didn't do a good enough job yesterday. But you have to remember, on the WGN thing, it's very limited time. I don't have time to go into a real long explanation of everything, but here we really have unlimited time. So here's the deal. The unvaccinated people are the ones driving the epidemic right now. The vaccinated ones are at least 5 times less likely of getting infected, 4 to 5 times less likely. 4 to 5 times, that's like 400 or 500%. All right, so the driver is unvaccinated. You look in the hospital, it's predominantly unvaccinated people. You look at the clinics where they're getting tested, it's predominantly unvaccinated people. You look at the hospitalizations, predominantly unvaccinated, and look who's dying, predominantly unvaccinated. Come on. So it's the unvaccinated are the driver. Not that it can't happen with a vaccinated person, but it's 5 times more likely or 4 times more likely that it's a vaccinated person. So this is why, from a public health standpoint, and to protect yourself and your family, you should not be in close gathering spaces with a mixture of vaccinated and unvaccinated. The vaccine is not good enough to prevent you from getting COVID. You can still get COVID if you're vaccinated. You're less likely to end up in the hospital and less likely to die. But who wants to get COVID? You don't want to get COVID. I mean, just because you don't end up in the hospital doesn't mean you get sick. And then who knows about long COVID? You really don't want to get COVID. I mean, it's under any condition. This is, man, woman, and child don't want to get it. So that's why I said you should not be mixing with unvaccinated people. So you have to tell your unvaccinated relatives they need to get vaccinated and then come. It's a little bit too late now because we're so close to the holiday. But I mean, they could start. They could get 1 dose, which does give you some protection. And then the other thing they can do, if they did that, they could get tested before they come. And then, tested like the next, if they stay for a couple of days, you can test yourself multiple times with these over-the-counter antigen rapid tests that you do yourself, and it takes 15 minutes, like a pregnancy test. So that's really that's the reason. You do what you want, but I'm just talking about risk. And, and a lot of these gatherings, have multi-generations. So you've got a lot of people in the family, grandparents, or somebody who's a relative who has a bad underlying disease, heart disease or lung disease, or they've got a cancer or something. You don't want to put them at risk. Why put them at additional risk? They can die. Right. And this is really, it's all about risk reduction. And you want to keep everybody as safe as possible. You keep the unvaccinated people away. It's just unfortunate. They have a choice. They can vaccinate themselves and protect their families and friends.
Definitely.
That is the personal decision. And so, it's time to step up and decide how you want to live.
Definitely. Well, those are all of our questions for today. Thank you, Dr. Murphy.
Great. Thank you, Sophie.